Hi everyone, welcome to BDI's next vlog. I know that you're all expecting to see Dan. Unfortunately, he's been sacked, so I'm going to step in for him today. I'm just kidding, he'll be back later. But we're going to talk about medical and clinical oncology. So obviously, for a lot of you guys, you'll already know the main difference between medical and clinical, but they both focus on the non-surgical management of malignant diseases. So the kind of two main groups with medical and clinical, the main difference being that clinical oncologists will deal with radiotherapy cases or treatment plans, whereas the medical oncologist won't deal with that. As a result, the kind of two main qualifications that you're going to be looking for in terms of Royal College are going to be MRCP and FRCR, so membership of the Royal College of Physicians and membership of the Royal College of Radiologists. Okay, so there's a number of things that you're going to want to have a think about if you're looking for a job in oncology in the UK. Probably one of the main ones is what kind of cancer care setting you're going to be working in. So every district general hospital, university hospital will mostly have their own cancer services or cancer wards. They can also be set within specific cancer centres like the Beatson or Clatterbridge, which just focus purely on cancer cases. But where you want to work and what kind of environment you're going to want to be in is quite important, and whether or not you are practicing clinical or medical oncology will impact kind of what centres might be better or worse for you. Within that, you probably also want to have a think about what site areas you've been covering. So if you're an experienced oncologist, there's probably one or two areas or site areas that you prefer to work within. So it could be lung, head and neck, GI, breast. But obviously for some of you out there, you may be generalists as well. And the demand in the UK varies depending on that type of hospital setting that we just spoke about and the site area. So most people won't be looking for generalists. They'll be looking for maybe a generalist with an interest in something, or with someone just to do pure interventional work or pure breast work and nothing else. So what you're looking for in your background will dictate whereabouts in the UK you can go to and what kind of jobs you should be applying for. In our experience at the moment within the UK, there are generalist jobs, and we do place doctors into those different roles. But if you do have a specific subspecialty interest and experience within interventional radiology or oncology and breast oncology, those are the two highest demand areas for us right now in the UK. Now obviously this is a pretty short video, so it's just going to give you a skim of what to expect, but once you get to the UK, most of your work within cancer services is going to be hands-on practical work. So you'll be spending a lot of time in the outpatient clinics, spending a lot of time on wards. There will be some on-call requirement, which I'd imagine would be similar to a lot of people in different countries, where you probably operate on a 1 in 8, so 1 week in every 2 months or 1 day in every 8 days, you'll be on call to answer questions out of hours. So maybe somebody's having complications as a result of chemotherapy and a GP or a junior doctor needs to ask your advice on how to handle a particular patient. You would be there and available. In terms of the salaries, you do get an uplift or an increase to subsidise you for the extra hours beyond the sort of Monday to Friday 9 to 5 job that you'd be doing. Occasionally you might get asked to come in at weekends as well. Again, similar sort of 1 in 8 rota where you might get asked to come in and do some ward rounds or some inpatient work as well. But generally speaking, it will be very, very similar to your home countries. Radiotherapy planning will be worked into any clinical oncologist job plans. You will have protected SPAs as well for your own professional development. So, in terms of cancer treatment and cancer services, there are different, there's a different flow for patients and referrals and pathways, and that sort of administration side is probably going to be the hardest thing for people to get their heads around. Other than that, obviously there are lots of opportunities in the UK for research. So a big part of consultant work, especially, is to do with clinical trials and advancing research on cancer. So anybody who is working in particularly one of the larger cancer centres will be expected to perform research as part of their day-to-day job. So I hope you found that useful. Alright everyone, thanks very much for watching. I hope you enjoyed our very short summary on oncology. If you've got any other questions or you want to go into a bit more depth in oncology specifically, or you'd like one of the team here to look at your background and figure out what sort of best opportunities for you might be, then feel free to get in touch and we will see you next time. Thanks very much.